Good afternoon, everybody. It's good to see you all. I see some familiar faces and names and some new familiar faces, some new names as well. I hope everyone had a chance to grab some lunch between Zoom calls today. And if you need to do so during this call, please do. Welcome to the Data for Equity RFP information session. I'm so glad that you could join us this afternoon. For those who I don't already know, I'm Becky Passner, and I serve as the Vice President for Evaluation and Strategic Learning at the St. David's Foundation. I'm joined by several colleagues today. First, I want you to meet Karen Wood, who will be operating the slides. She's also our DJ this afternoon, and you've received emails from her in the past. And I also want to introduce you to Natalia Choco, who will be monitoring the chat. Thank you both. Today's session will be recorded, and the recording and slides will be available within 2 weeks on our website. We love hearing your questions and comments. We've also reserved 20 minutes at the end to address these, so please hold your questions to the end or feel free to drop them in the chat throughout the presentation. The Data for Equity RFP aligns with the Foundation's overarching goal to advance health equity, which guides our work in 5 programmatic goal areas. Those areas are resilient children, healthy women and girls, older adults age in place, thriving rural communities, and clinics as community hubs for health. Evaluation and strategic learning is a tool that runs across these 5 goal areas and works to advance health equity by ensuring that data, research, and learning drive the evolution of our strategy, support sound funding decisions, and inspire action in Central Texas. We are so glad you are here today to learn more about this opportunity. Thank you so much for coming. I'm now going to hand it over to Ellie Copeland, who is our Senior Evaluation and Learning Officer, to share more about this funding opportunity. Thank you.
Good afternoon. Thank you all for joining us today. It's great to see so many people interested in equitable evaluation. If you haven't had a chance to do so yet, please introduce yourself in the chat. For the remainder of the hour, we will be sharing information on the Data for Equity funding opportunity, including an overview of equitable evaluation, and examples of this work in action, as well as the RFP details. As Becky said, we'll have time for questions and answer at the end, so please chat your questions and we'll make sure to address them during that portion. This request for proposals is a funding opportunity to align new or existing program, organization, or community level evaluation with equitable evaluation practices, or to build community learning that brings together evaluators and/or practitioners to explore what equitable evaluation looks like for them. Funding will total up to $200,000 with a maximum grant of $25,000 in the first year. We will also work with grantees to come together for learning opportunities at least 4 times over the first year to share lessons learned and support collective learning. Our hope is that this effort leads to a shift in evaluation practices that improve program and organizational outcomes to advance racial equity. We know that shifts in practice follow shifts in thinking, and increasing the sector's understanding of evaluation practices that center equity is a key outcome we hope to see from the Learning Collaborative projects. Before we dive into the funding opportunity specifics, we want to zoom out to the overarching goal of advancing racial equity. When we think about the Foundation's goal of advancing health equity, we recognize the important role race plays in systemic inequities. For that reason, this initiative focuses on supporting nonprofit organizations working to improve the social determinants of health in Central Texas and testing evaluation practices designed to advance racial equity specifically. Key in this is the understanding of racial equity and health equity more broadly as both a process and an outcome. We've adopted Race Forward's definition of racial equity. As a process, it defines racial equity to be when those impacted by structural inequities are meaningfully involved in the creation and implementation of the institutional policies and practices that impact their lives. As the Foundation moves forward with our equity journey, we understand equity in this way, and it helps us to rethink how we do our work, which for our evaluation and strategic learning team means shifting our practices towards evaluative thinking that centers equity every step of the way. But what does that look like? This is the question we've been trying to figure out, and we're not alone in that. The Foundation is an active member in several local and national learning communities focused on evaluation, and all of them are currently exploring opportunities to improve upon traditional evaluation methods and move towards more equitable practices. One thing that we've learned through these conversations is that equitable evaluation is not a single method or checklist of practice. Rather, it's a new orientation to the work. One resource that was developed collaboratively by innovators in philanthropy is the Equitable Evaluation Framework, which offers 3 grounding principles for equitable evaluation that are on the screen. It starts with recognizing the role evaluation can and should play as a tool to advance equity. It focuses on including community members in the design of the evaluation, data collection, analysis, and interpretation of findings. This is a key shift for the field of evaluation, and it stems from the recognition that lived experience is a powerful starting point for developing effective solutions, and community member voices are essential throughout the process. Finally, equitable evaluation seeks to answer questions about the conditions impacting individuals and communities. This means naming key assumptions and systemic inequities as a core part of the evaluation. As we think about putting these principles into practice, we've turned to our peers and community partners here in Central Texas who are exploring the same question. Included in the full RFP document, which you can find on our website, is the list of equitable evaluation considerations to advance racial equity. This list is a starting point that draws on shifts in thinking and in practice that many individuals and organizations are actively exploring in our community. It's not exhaustive, and we hope that it is a useful starting point that we can build on together through this initiative. In the RFP, we also share additional resources and models for equitable evaluation, and we hope you will share resources that you found helpful in your applications or here in the chat now. Learning from each other is a key outcome of this initiative, and we want to support collaboration from the start. To that end, we're going to chat link to a Google document where you can share your contact information with other applicants if you're interested and open to partnering on a project. Know that if you put your name in, it'll be accessible to anybody else who shares their name, and they will reach out to contact you or vice versa. In the spirit of learning together and building on existing models, we're very fortunate to have leaders from Measure as thought partners on this initiative and co-presenters for today's information session. We're delighted to have Mimi Stiles, President and Founder of Measure, and Paulette Blanc, Chief Research Officer for Measure, with us today to share the history of their organization and an overview of the tools and models that they use for equitable evaluation. With that, I'm going to pass it over to Mimi.
Good afternoon, and thank you for that amazing introduction. Yeah, my name is Mimi Stiles, and I get to be the president and the founder of this amazing research and public education organization called Measure. And I'm so happy to see so many of the organizations that we support directly here in this group today. So in 2015, we started Measure to promote the use of evidence-based projects and tools to tell real-life stories behind the numbers. You can go to the next slide too. And so over the years, Measure has really grown to be a fully operational nonprofit organization that provides free data support to Black and Brown-led organizations. We also provide our consultative services to businesses, to schools, to foundations, but ask them to pay the full rate for our services so that we're able to really sustain that anti-racist revenue model. And let me go ahead and pass it over to my faithful sister in justice, Paulette, for an introduction.
Thank you, Mimi. Hi, my name is Paulette Blanc. So happy to see so many familiar faces, and hello to all the new faces. I'm one of the co-founders and chief of research for Measure, and alongside Mimi, I'm just honored to be here with you all today to share how Measure has been achieving our mission. Next slide.
And so over the years, as a team, as a community, Measure has been on a mission to use data and education to really mobilize communities to eliminate social disparities. At Measure, we believe that lived experience and quantitative data about complex social problems impacting people of color is not used as effectively for change, and that's for a multitude of reasons, right? It's because of historical, structural racism, institutional racism, lack of accessible data tools, and because of the lack of village support. And so at Measure, we have several programs. Some of you have heard maybe about our Innocence Initiative. But again, one of our main program is around equitable evaluation and providing that free evaluation service to Black and Brown-led organizations. And so, you know, what that might look like is like when an organization is ready to push back against a law or a policy, or or wanting to better seek to understand crime or justice in their community, they might partner with Measure to strategically address that issue. Next slide. And this is what we do. Without that equitable framework that Ellie was talking about built into models and technology tools, we risk the continual perpetuation of racism in our largest institutions and social services in America. We risk it, especially through evaluation, right? We realized that really early on as a grassroots organization. And so during that time, we began to really think deeply about what it looks like for equitable and new evaluation models to fuel change. One thing led to another, and this is really what we've come up with. These 4 tools: the Measure Care Model, the Equity Focus Group tool, the Community Survey Design tool, and the Community Impact Metrics tool. Next slide.
The CARE model essentially is this foundational principle which a lot of these tools operate off of. The CARE model, in which CARE stands for Community, Advocacy, Resilience, and Evidence, is a process for working in active partnership with communities to develop solutions to complex social problems. It provides a means for increasing meaningful engagement and minimizing potential trauma to the community. The C stands for community, being involved in the beginning. I think oftentimes, or when we were starting this process, we saw that people would come up with solutions and go to community and say, hey, here's what's gonna work for you. And so we really want to be very mindful of including community from the very beginning. A, advocate with communities to address disparities. R is to generate solutions that strengthen community resilience. And E, which as a data geek is my favorite, is use data and evidence for data-informed decision. This model allows us to prioritize data collection and analysis in a way that is community-led. The CARE model process takes great care to make sure that those that are engaged in the process aren't perpetuating harm. We know that there are countless ways in which the BIPOC community, Black, Indigenous, and people of color have been betrayed by traditional academia, data collection, and research. So as we work to define and progress this movement of data activism, we must uproot and disrupt traditional research methodologies that leave out people and their expert experiences. So this is fundamental to Measure's CARE model. The CARE model also is used to deeply think about how we can reduce harm by setting ground rules about the sharing of data, ensuring the accessibility of findings, ensuring that community members involved in research also gain benefit from participation, being sure to credit community members appropriately, and walk community members through the development of a data collection plan. And on the next slide, we can share some examples. So one example here is the Boys Matter to Men. This is a nonprofit organization in Central Texas that went through the CARE model process. And so they had a CARE team, which is a group of people that typically about 6 folks that come together on a weekly basis for a few months to be able to walk through this process. We want to always make sure part of this CARE team are people who are most impacted. So in this CARE team was boys, parents, and other stakeholders, and in addition to folks from the organization. And so from this process, they were able to, one, empathize and understand more about the needs of their community, who they were, what those experiences are, or were, particularly walking through some of the injustice that's happened over time that have led to the particular problem that they're trying to solve. They've come up with some solutions. And then they also have, here you can see some of their community impact metrics. And what's really cool is that we also call them the Measure Community Impact IDs. And these are like tags in which in the future world that we're already starting to build, that they will be able now to use these tags to connect with other nonprofits that are working on similar missions to be able to increase in collaboration and increase their impact. Another example that we have is from another tool, which is our Equity Focus Group tool. It uses a lot of the same foundational principles of the CARE model, particularly with conducting focus groups. This particular focus group worked with the Austin Community Foundation, looking at disparities within philanthropy and really elevating the lived experiences of leaders and nonprofits that are trying to access funding. One of the quotes that I actually really like, just reading a piece of it, is that blue, dark blue, navy blue area where it says, hire those within the community that need assistance. And I know as we were building the CARE model process, that's a process that was developed within communities. A lot of the things that was said and that we heard from people's experiences were that oftentimes people seek to hire other people outside of the community to develop solutions for people who already have a lot of this experience with the problems and do have solutions as well. So I thought that was a really impactful quote that came out of that, of people's lived experiences from these focus groups. And so with this tool, this organization now has some recommendations on how they can improve their processes with distributing funds and creating opportunities. So I will now pass it over to Mimi to talk about some of our lines in the sand.
Yeah, next slide. And thanks for that shout out in the chat. I'm, again, so excited to see so many organizations that we've been able to work with over the past couple of years. Yeah, so over the past couple of years, we've also been able to learn a lot, right? We are a continual learning organization. We've done some work with several organizations that have helped us on that learning journey as well. And what we've found is that there are some lines in the sand that we just will not compromise on at Measure. And we're holding other organizations accountable to doing the same thing, which is pretty incredible. One is that we center racial equity the whole entire time, the whole way our CARE model process is delivered and facilitated. We center racial equity. We believe in and understand CRT, critical race theory, and how it applies to the work that we do in the field. We also believe that lived experience is data. We know that lived experience is data. We know that people, period, understand what works best for their community if you just ask them. Accessibility of finding is really important, right? And so if we ask for data, then we want to give that feedback back to communities. It's not anything that we want to hold on to as, information just for ourselves, but instead, how do we give data back to communities for action? There's even a part inside of our CARE model where the end is always something for action. It's our research must inform change, and we co-create that change with organizations like Black Austin Coalition, like the Maternal Health Equity Group, like several organizations. It's all about change. Next is benefit to the community, and this is a line in the sand that we have held pretty true this whole time, and have really pushed within our community, especially in Austin. And it's, what is the benefit that people are getting if they provide you data and if they sit down with you and provide you information about who they are, about their lived experience? What is that benefit? And so we always ask for the benefit statement. That benefit could be several things. It could be funding, it could be support, it could be a free medical appointment, therapy, whatever that looks like, we ask. And then lastly, community voice. Most important to me, my core value, community voice, is really about, elevating the lived experiences of those that we are trying to support. I don't even really like to use the word help. It's about support. It's like, how do we share what we know to support you in what you actually know? And these are our lines in the sand. We have several more. We only wanted to present a few, but during this RFP process, during our partnership with SDF, we will have an opportunity to sit down with those that are interested to learn more about the way we do things in equitable evaluation. Next slide. And just a big thank you. And if you are interested in working with Measure or learning more about the work that we do, here is how you contact us. We, again, prioritize Black and Brown-led organizations for our support for free. You are able to apply for that support on wemeasure.org. Thank you so much for this time.
Thank you, Mimi and Paulette, so much for that insight. I think specifically the lines in the sand developed by Measure really helped to demonstrate what this work actually looks like within organizations and on the ground. So that's, I think, very helpful as we're describing this opportunity. So at this time, I'm Jesse Simmons. I also sit on the Evaluation and Strategic Learning team at the Foundation. And I'm very excited to be a part of this opportunity. And at this point in time, I want to focus on very specific information about the RFP that may help as you're developing your application. So this is a high-level review of what's already been discussed with the RFP. I just want to reiterate that the total available resources for this RFP is 200,000 with a maximum of 25,000 per applicant. So the review and selection committee that will include members from the community who are deeply involved in equitable evaluation will select somewhere between 8 to 12, maybe 15 proposals, depending on the size of projects that come in. So there's a lot of interest looking at how many people are attending this info session. We're not really sure what that will translate to the number of proposals that come in. And again, we encourage collaboration through that Google document for people to come together and present some projects. On the next slide, I want to review some very specific ideas. It's not an exhaustive list, but to give you some ideas of the types of projects that would be eligible for this opportunity. It really can be a range. I think as you're developing your application and what project you want to propose, the balance that you'll have to consider, I think, is in order to do this work well, in order to fundamentally change the evaluation practices of an organization, that takes time, resources, and critical thinking. So that needs to be balanced with what can be realistically accomplished within 1 year and at $25,000. So this could look like a small step to better include equitable principles in your evaluation practices to fundamentally changing. So a light touch could be going to participants to review a survey or instrument with a very specific focus on, do the measures of success that the organization is focused on, does that resonate with community members? To a much more in-depth conversation with community members on sense making of the data and really being included in developing the recommendations for process improvements to your program. So to be very clear, I think on the high end of the $25,000, we're hoping that projects both include but go beyond the principles of participatory evaluation, which is a very good starting point. But equitable evaluation, among other things, is really about sharing power as one of the key considerations. So I'm happy to answer more questions about potential projects, but that will give you a little bit of an idea. And something else I wanted to mention is that we were very specific in the RFP that we wanted to include language that there will be an opportunity for continuous funding after the RFP is over. So the first year could look to include some planning work, and it might be helpful as you're developing your responses to be very clear about what you're hoping to accomplish in the first year, but to briefly describe future plans that further the journey to implement equitable evaluation practices. Next slide, please. Thank you. To be clear, while we're very open to supporting instituting new equitable evaluation principles to help organizations who are just starting to implement new practices, to be quite frank, we're interested in supporting organizations that are further along in their journey to both thinking about and understanding equity and the impact of racism in public health. So changes in practices often follow changes in thinking. And so, and we're also, we mentioned the 4 convenings that we're hoping to provide over the course of 2022. And we expect that those convenings will include very interesting, but also very difficult conversations. So we're hoping that participants come from organizations that are further along in their understanding of the impact of racism in public health. The next slide shows, also collaboration. Forgot that on that last slide. This is just a high-level overview of the timeline. Today's the information session. We have feelers out to identify the external reviewers who will help us select the applicants. We are planning a orientation meeting before proposals are due 1 month after the opening of the RFP. That will be facilitated by an external consultant. The reviewers will use the month of October to review and score proposals, and funding decisions recipients will be notified mid-November. Speaking of the convenings that will be happening over the course of 2022, the application has a specific question. We want to hear from you on both topics that those convenings might cover, as well as potential groups to lead those conversations. If there's anyone in this room who is a leader in this work and wants to be part of those, leading those discussions, please reach out to us. We'll be sharing our contact information so we can explore an opportunity for that. I also want to mention that when appropriate, thinking about the power dynamic between funders and nonprofits, but when appropriate, evaluation staff from the foundation would like to participate and learn alongside our partners. We are not the expert in this field, and we have a lot to learn about improving our own evaluation practices to make them more equitable. Finally, the full scoring rubric is included at the end of the RFP. I'm not going to go through all the details of that rubric, but I'm happy to answer any questions that come up in the chat. But I did want to share that we see this rubric as a starting point for the conversation. So how proposals fall on the rubric won't necessarily determine final decisions. Other considerations that we're looking at is that we're interested in both the diversity of the organizations that are selected, as well as the range of size and types of projects that are selected. So further support, we will be creating a FAQ based on the questions that come up in this chat, as well as within our ongoing conversations, and we'll be posting that on the RFP page of our website. We also are providing office hours that start tomorrow. So if you are interested in having a 20-minute discussion with us to further explore your ideas and projects, please reach out to Karen Wood. We'll throw all of these emails in the chat following this conversation. And lastly, one thing I wanted to mention is that for small organizations that have few staff members, we are able to provide a consultant to provide technical assistance related to grant writing. This is something we provided in a previous RFP, provided by the foundation, and it was very popular. So we're excited to provide that again. If you're interested in that, please reach out to that evaluation strategic learning email so that we can help coordinate with that consultant and you to provide that technical assistance. That's it for me. I'm going to turn it over to Natalia and others to help us go through the chat and lift up any questions that our team can answer. And please keep the questions coming in chat as we do that.
Yes, thank you all so much. I've been watching the chat, haven't seen anyone chime in just yet. So we're now at the Q&A portion. Feel free to either drop your question in text here or shout it out. We're here for you.
I'm happy to share 2 questions that have come up as this opportunity was shared that were emailed to us in case it's applicable to anybody else on the call while y'all maybe chat additional questions. One is, are public entities allowed to apply? And so yes, 501c3 or a public entity is allowed to apply, and that eligibility criteria is included in the information on the RFP webpage. In addition, there are a list of attachments that are part of the application, and we recognize that for smaller organizations, 990s or audit might not be something that's required of your organization. So although all those are listed in the actual application submission form, they're optional, and you can submit a letter explaining the circumstances for your organization at this point in time. And if you have additional questions like that that come up as you're exploring this opportunity, please feel free to reach out and have a conversation with us about it.
Thank you. Okay, so we have a couple questions rolling in. I'm going to start with one from Robin, wanting to know what is the relationship between Measure and St. David's Foundation for this proposal, and are applicants encouraged to work with Measure, and essentially just speak more on that relationship.
I'm happy to answer that one, and then I'll look to Mimi or Paulette to jump in on anything that you would like to add. So Measure has been a grant partner of St. David's Foundation for the past couple of years, supporting their work, and they've been an important collaborator and thought partner as we've thought about bringing this opportunity to the community. So they have reviewed the concept and the actual document. In addition, as you all experienced, they were able to share more on their model today. And we lift them up as a great example of one local model and recognize that there's additional models locally as well as around the country that we're open to exploring and learning from as well. Measure did share the key aspects and tools that they use, and they are a wonderful partner. So we imagine there's going to be a lot of interest from applicants in potentially partnering with Measure. That is, Measure will use their prioritization, which is for prioritizing Black and Brown led nonprofits for their support and thinking about their internal organizational capacity as they assess their opportunity for collaboration. So that is a conversation that interested organizations can reach out and have with Measure. The foundation will not be involved in that process. And in addition, we would like to bring some of the wonderful workshops that they provide to the community to interested grantees and applicants. And so they will be one of the 4 learning opportunities next year, providing a workshop where we can go deeper onto some of what they shared today related to the care model and other tools, as well as some technical assistance hours that will be accessible to grantees through that. So I'm going to look at the Measure team if there's anything I missed that y'all would like to add related to that.
I think you did a great job, Ellie. No, we're super excited to learn more about the projects that y'all are doing. Again, we do prioritize Black and Brown led organizations. So if that means that they can partner with us and then that their funding goes a longer way, right? Because we all know that in many cases, Black and Brown led organizations do not have the philanthropic support that we need to reach our capacity. And so we prioritize that, Black and Brown led organizations. But again, we are 100% interested in supporting other groups as well.
Thank you. Okay, we have a question from Heather Nickel. What about an example of a project that would meet the criteria and be a successful competitive proposal for this RFP?
I can take that. And I also see a question about, I mentioned participatory evaluation very briefly. So participatory evaluation, as it usually ends up on the ground, is that you're asking community members to be part of the design of the evaluation, and they're often involved in data collection. You're asking them to go out into the community and collect the data. That's an important piece. It also often falls short in returning to the community and having them be involved with the sense making of the evaluation. So the gold star of equitable evaluation is when community members are part of the decision making that happens after the evaluation. So that would be kind of the grandest scale of a project, even though we're also interested in those small steps as well. But that would be kind of the most at the higher end of projects that we would be looking at. I'd also say that equitable evaluation also often changes the focus of the evaluation as well. It's not just about the process, but often what hypotheses you're testing. So you're focused more on the systemic barriers and the barriers that participants are facing, not just kind of individual behavior change.
I was just going to add that there's a list of example projects in the RFP document towards the end that might be useful to take a look at as you think about building a project that align with the criteria.
Thank you so much. Okay, moving on to a question from Gail. Are you looking for specific projects or for higher level change in the overall approach in project design and evaluation at an organization?
Both. We are interested in either. I would say that any specific projects we hope tie into a larger conversation with the organization and or the community to think about what was learned through that and how it can be put into practice and adopted across multiple streams. Either qualify.
Great. From Morgan, is the idea that existing staff will use time to do this work, or will organizations be looking to hire a consultant, in your view, to support this process?
It's a great question. And I think honoring the time of staff is part of the process. So I think funding can definitely be used to support existing staff doing new work. Also, an option would be providing funding to community members as stipends if they're involved in the work. Funding could be used for that.
And if so staff time is definitely eligible, and we look forward to hearing those ideas. In addition, if you are interested in working with an external consultant, we would be interested in how it's also building the capacity of the organization to sustain the practices after the consultant's contract is over.
From Angela, wanting to know, this is Yasmin, wondering if St. David's Foundation will be sharing the full list of participants from today's session.
That's a great question. We're not going to share the full list because we haven't asked every attendee for permission to share the information that they use during registration. But we do encourage you to include your information on the Google Doc, as that will be shared with anybody who signs up for it. And there's some great ideas already included in there. If you just want to include your name and email, that's okay as well.
Okay, so this question is from Angela. Can you provide examples of what's meant by strong proposals from organizations that are further along in their process?
Yes, I think there is a question in the application that specifically asks about how equity shows up within your organization. So this could include, how it shows up in your mission, how it shows up in your program design, examples of how the organization has dedicated resources to staff trainings and further understanding of equity issues and the impact of racism. So this is kind of a off the cuff, but we've often heard from organizations that are at the high end of including equity that this is a hard application question to answer because equity runs through everything that they do. So that's something that you just have to consider of how to clearly demonstrate it within the application.
And to clarify, we'll prioritize organizations that are farther along in their equity journey. So it doesn't necessarily mean that they have advanced evaluation staff capacity or systems. We're looking to honor the work that's been done by organizations around racial equity as we look at proposals.
Thank you. Okay, could you talk more about continued funding after the initial round? And just that many organizations already have data and proven methods of equity, but might have needs for management, staff, sharing and replicating these methods. And this is a question.
Thank you for sharing that question. And it is something that we have been discussing internally and would love to continue the conversation with this group, and hearing feedback about what this can and can't do will be important as we think about future funding. We, as evaluators and learners, we recognize that we want to be able to apply what we learn through the process. And so one-time funding doesn't necessarily allow for those emerging ideas and iterating on where we start. So we are leaving it open to see where this takes us, and hope that we will be able to support grantees as well as applicants who submit this round but might not be interested in sharing back what's learned and thinking about how we can continue to support this community with over 100 people on this call and continuing to do the work. So I don't have a specific answer about continued funding, but I would encourage you to reach out to the eval strategic learning email address that was shared, or attend office hours, and we can talk more about it for the specifics of your project and think about how it can fit within this funding opportunity, as well as some potential other avenues as well if this specific requirements doesn't align.
Thank you. Okay, next question from Courtney. I know you're looking for diversity within the organization. What if the organization is small, like a team of 2? Should we still apply?
Definitely, yes. And I think size of organization is also something we're looking at, particularly grassroots organizations that are deeply connected to the communities that they support. So that's another consideration.
Okay, could collaborating orgs apply separately for their parts of a collaboration for a total in funding that is over than the $25,000 cap?
I think that that's a great question to explore in office hours. We had been thinking that it would be one lead organization applying under a collaboration, but I do think that there are possible opportunities that, depending on the roles that the organizations are taking and how they're thinking about applying the practices, where they could sort of be partner applications. So we don't have a set process for that, but would love to talk more about what that could look like and hear your ideas.
Thank you so much. We've had amazing questions thus far. If anyone's still thinking of something, feel free to drop it in. This has been really wonderful.
And as Natalia mentioned, we'll be putting together an FAQ based on today's conversation that'll be posted on the website along with the RFP details. And we know that not all the questions might come up now, but perhaps in the coming weeks. So we do encourage you to reach out through the evaluation and strategic learning email address, as well as the office hours that we're hosting tomorrow. And then we have some at the end of the month as well. Happy to set up a time to chat more. So thank you. And the Google document is great to see that folks are inputting. We will make sure and include that in the FAQ link as well. We're happy to stay on if some questions come up in the next 10 minutes. I also want to give a big thank you to Mimi and Paulette again for being a part of today's information session and for all of the amazing work that Measure has done. It's great to have you guys here and as partners on this work. And thank you everybody for attending. Like I said, happy to stay on if you need to hop off. We also understand.